Hi, I'm Sharrie Harlin-Davis, program host for Reid Beside You. And today we're looking at end of the year wellness checks. Today we have our guest will be Dr. Dr. Ahmed, our MD from Reid Pediatric and Internal Medicine, as well as Tajuan Stoker, Director of Reid Wellness. Welcome.
Thank
Thank
you.
you, Sharrie. Thank you for having me.
And I'm going to start with Dr. Ahmed. She's new to to Reid Beside You. So, how did you come to Reid?
Well, I'm originally from New York. That's where I trained. That's where I practiced for a little while. Then, actually, my family and I wanted a smaller community setting where we wanted to raise our kids. And so initially, we moved out to the Midwest in Nebraska, and that was a little too rural for us and a little bit too small of a community. When I found Reid, it sounded perfect for our family needs. We had what we needed nearby, family was nearby, and it was an ideal job position where I could spend a lot of time with my family and still do what I enjoy. So I'm glad to be here. I'm glad they chose me to come here. And so far, I've been enjoying it greatly.
Well, great. And welcome to Reid and welcome to our community. And we're going to
Thank
start
you.
asking some questions for Dr. Ahmed first. And when we first hear about end of year wellness checks, we often think of we get those with physicals and just requirements. But we're going to look at this since you're dealing with pediatrics. Looking at what parents should be doing now to make sure that their child or their teen starts 2022 strong.
Okay, Sharrie. So at every well check, I talk about the same things with every parent and every child and teen. And the most important things that I like to outline is making sure that their child is eating well, healthy food options, eating their fruits and vegetables, drinking water and staying hydrated, and exercising and staying active. It's the winter time. People are going to be indoors for a while. And so finding ways to get active and stay active is going to be important for mental and physical well-being. Sleep is another big thing that I bring up. A lot of our teenagers and children have issues with falling asleep and staying asleep. We all like to be on our phones and iPads and other technology. And I think that plays a huge part in why our teenagers and our children are tired so often. And it's oftentimes because they don't have a good nighttime routine. So establishing a good bedtime routine, putting phones and electronics away before bed, and making sure that they are getting at least 8 to 10 hours of sleep will help make sure that they're not tired throughout the day and that they're starting the year strong. And then this is a little bit specific to the pandemic, but a lot of our families took their children out of their normal after school activities and extracurriculars because of the pandemic. And so I think now as we are coming out of that a little bit and more people are getting vaccinated, we should be able to bring our kids back into the activities so that they can continue to thrive. And then lastly, I also make sure that families are spending quality time together. I think that this past year, a lot of people were able to do that. They were staying home and staying indoors. And so they had a lot of time to be able to do that. And that's just as important as any of the other things that I spoke about.
Okay. And when you did mention earlier about COVID, and what are we now that the COVID vaccine is available for children? Get your thoughts on what about the COVID vaccine for children?
I am extremely excited that the vaccine is available. Initially, it was only available for our teenagers, 12 and above. And last week, it got approved for our younger children, ages 5 through 11. I'm super excited that that has happened. I feel like even my own children, every few weeks, they were being quarantined because they had constant exposures to COVID. And so the hope is that the risk of exposure will drop. Our children will be able to stay in school longer. They won't have to quarantine as much, and hopefully won't be getting sick as much because of the COVID vaccine. So I'm extremely excited for. I can't wait for my 7-year-old to get it as well, so that he can continue being in school and staying there where he thrives.
And on the subject of immunizations, what should we be seeking? Just and when I'm saying that, I'm also including just regular immunizations as well.
So at every well check, when our children come in, we always make sure that they are up to date on their vaccines. We have a state registry, so if a child wasn't seen here before, we're able to pull it up. If they were in the state of Indiana elsewhere, we're able to pull up their vaccines and double check. We recommend all routine vaccines to be completed, so we don't have an outbreak of other illnesses such as measles, mumps, and pertussis. A lot of your other diseases that you don't hear about anymore because so many people are vaccinated against them. And then the flu vaccine is another one that is a seasonal vaccine that I highly, highly recommend that everyone get. Now, last year we didn't have a very prevalent flu season, and that was because we were all masking and staying indoors. And so that's why we think there wasn't a flu season. But this year we're a little bit back to normal life somewhat. And so we expect that there may be a prevalent flu season coming up. So it's going to be important for everyone to start getting vaccinated for the flu.
Okay. And another thing, what about emotional well-being first, especially teens with the increased anxiety and depression? What are we seeing?
Yeah, so these past 2 years, I think they've been really tough on us as pediatricians, and even harder for kids and teenagers. We've been seeing a lot of anxiety and depression in households that we've never seen before. I would say about half of my clinic time right now, every single day, is made up of some sort of mental health visit. The pandemic has especially put a huge toll on kids who already had maybe mild anxiety in the past, and this pandemic has kind of put them into overdrive. Kids are worrying about, who's going to get COVID next? Is their loved one going to die from COVID? Are they going to get really sick from COVID and end up in the hospital? So that definitely has taken a toll on kids. Other children who maybe felt isolated from their peers when they were in school, things just sort of got worse for them. Last year, a lot of schools were not doing in-school learning, and they were just doing online learning. And so that really took a toll on a lot of our kids who already felt depressed and not able to go to school. That played a huge role in that worsening. In addition, school for a lot of kids was a way out of their stressful home lives, and that was lost because of the pandemic. A lot of teachers who were picking up on a lot of this anxiety and depression in our teenagers weren't able to do that because kids weren't going to school. So that definitely affected a lot of things. I will say since the pandemic started, we have seen a rise of suicidal attempts and actually completed attempts as well that come into the ER, oftentimes in kids who never showed any previous signs of depression or anxiety. When kids come in for the well checks this year, if they haven't been seen in the past 2 or 3 years, we will find that when we screen them for anxiety and depression, they're positive. And a lot of time the parents didn't even know that their child was struggling. So this pandemic has only brought in bad things for us. It hasn't brought anything good for us at all. So I urge everyone to get their children back into their pediatrician, see their family practitioner, and talk to their kids about what's going on, how they're doing. And let us help them, and we can go over ways that that parents can help their children as well moving forward.
On that, when you were saying we've seen more of the suicides as well as attempts, are we seeing more people asking for screenings and referrals for mental health with their children and teens?
Yeah, since the pandemic, we are slammed. Our therapists are slammed, our psychiatrists are slammed with referrals, and our inpatient hospitals are slammed too from admissions from these suicidal attempts. We oftentimes have waiting times that are as long as a few months to a year, even in certain places. So it's been really difficult for everyone, but the best thing that I can say is start with your primary care provider, get your child into their primary care provider. They can often expedite a lot for your child, depending on how urgent the situation is. A lot of the times we can start other treatments, and there are other options in the meantime while we're waiting for some of these specialists to pick them up. So that's the best place that I would start.
Okay. And if people need to or would be interested in speaking to you, we have a slide that shows how to contact Dr. Ahmed at Reid Pediatric. And I know you have to get back because you have patients, and we always wanted to have patient care first. But is there anything you'd like to leave us with?
I think I would just like to say that I really urge parents to call to their pediatrician, reach out to them, ask them the tough questions. That's what we're here for. You know, whether it be vaccine information about the COVID vaccine, side effects, whether it's questions about their child and what's going on with them and how to speak with them, just reach out to us so we can help you. You know, it doesn't have to be, you don't have to come into the office if you're worried or if you're not sure what's going on. We can help you over the phone for the time being. And then sometimes we do have to bring you in just to get a bigger picture of what's going on, but we won't know until you call us and you talk to us. I also like to say that, you know, don't listen to social media platforms. There's a lot of misinformation out there and a lot of things that aren't scientifically proven. You know, a lot of us spend time reading all these studies, and that's what we go off of. And these are available online as well for you to read. So don't trust anyone else. Do the homework for yourself, especially when your child is involved.
Well, thank you. And thank you for joining us today, Dr. Ahmed.
Thank you so much for having me.
And next, we are going to meet with our wellness director at Reid Health, Tajuan Stoker.
Hello.
And thanks for joining us today, Tajuan.
My pleasure. Happy to be here.
And I know personally from a Reid Health standpoint, when we think of wellness, we think of Tajuan and his team. So it's good to have you on the show today. And first, we're going to just talk about routine wellness checks.
Mm-hmm.
And how are
Yes.
they beneficial to patients of all ages? Because often people hear a wellness check, you think about people going to school, or I know on the Medicare age, people need to get a wellness check. So how are they beneficial to patients of all ages? Often they in between that when it's mandatory, people tend to sometimes let that go.
True. Very true. I think with a basic wellness check, one thing that's important about a wellness check is that you're now building a relationship with your primary care physician, right? So you want to look at it as not just you going just to get a checkup, but also going to so your physician can know, you know, what's going on with you health-wise. So just in case something else happens in the future, then that physician already is in tune with your body, what your issues are, or any kind of concerns that you might have had, you know, before something actually happens. You know, and oftentimes you can also have, you know, some of those deep discussions with your physician, just as Dr. Ahmed just said, you know, things about, you know, depression, you know, if you're not feeling a certain way, your physician can pick up on that if you're having those normal, you know, visits with your physician on a yearly basis. I mean, they're very important for that, the relationship part. But in addition, it lets you know where you stand. You know, it lets you know where you need to improve at, and it lets you know where you're doing well at also.
And back on that, on what the patient can learn on where you stand, and I like that when we want to lead to making sure that you actually follow up, something haven't done before. And I made a hiccup and I didn't follow up on something and it led to a bigger issue. So say why, can you share with us why a person should always follow up
Well,
and what you
one,
learn?
if your physician is giving you guidance on something that you need to do, you need to trust that physician. I mean, they're telling you from their experience, from what they've seen from possibly from other patients, and from what their research has shown as well, and that what their background has taught them, is that there are certain things that you need to do to make sure that you're being healthy. And if you ignore what they're saying, if you get the paperwork in your hand, or if you get the information sent to your my chart, and you don't follow up with those different pieces of it, you're putting yourself at risk and in jeopardy for something more serious to happen later on down the line. Listen early on, pay attention to what your physician is saying. Read that information that's been put into your hands, even if it's from us in a wellness department type of perspective. If we're out in the community giving you information, pay attention to those little tidbits that we're actually giving to you, so that way, you can do all the things early on to keep any kind of disease states away, or any kind of serious illness away too.
Then if we move into goal setting, and what's your take on goal setting and the best way to move forward on getting a goal and sticking with it?
I think goal setting is something that many people struggle with. Sometimes we want the large, big goals, right? We say, it's November, and by December I'm going to lose 25 pounds. Now, you have to be realistic with yourself. Or it's November, and in December I'm going to start. I'm going to walk 5 miles a day. Each day starting today. And you never walked a mile, so I think we all have to be somewhat realistic with ourselves and take baby steps. Our goals need to be realistic. They need to be timely. They need to be some of those things where you look at it and you put it on your calendar, and it's something that you stick to on an ongoing basis. And you need to protect your time around your goals too. So if you know that you're easily distracted and that time gets away from you on a normal basis, you utilize your support systems that are around you as well. If you have friends and family members, that are coworkers that are doing something that are in a similar fashion that you're doing, ask them to help you stick to your goal. There's nothing wrong with that at all, to get a little help along the way with your goal setting. So just make sure that all your goals are obtainable and that they're not things that are just so far out of hand. And of course, as always, we always offer up our help in the wellness department to help any individuals that, that want to try to achieve certain goals along the way.
So on that same note, your health team and your wellness team, they're also not only are they a service for Reid employees, but also out in the community.
Mm-hmm.
And could you share with us some of the opportunities out in the community that could jumpstart their journey?
Yeah, no problem at all. So right now we're currently in our planning stages for 2022. But I'll tell you, through our Reid Healthier initiative, which is basically we take a lot of our different initiatives that we do internally. So we kind of test them out first, and then we add a little bit to it because we know possibly there may be different challenges within the community. And that's throughout our whole service area that we serve. So our Reid Healthier initiatives, we may have exercise classes in the park. We may be doing point of care testing where we're doing finger stick, and taking cholesterol measurements, maybe doing blood pressure measurements out there in the community. We're working with different partnerships with different park systems along the way, different school systems, so our goal is to make sure that we're getting all kind of different type of well-being and wellness initiatives out in the community, so that way, it's easily accessible, and individuals don't have to go far to be able to, participate in different wellness activities. So I would say look for our schedules to start coming out for 2022 towards the end of December, mid-December. We'll usually put them on our Facebook page, or we'll put them on our reidhealthier.org, which is our wellness portal that we have for the community. And so that's one of our biggest initiatives too, is our wellness portal that we have for the community. Individuals can actually sign up for free to our wellness portal. And once they sign up, they'll start earning incentive points. And these points can be turned in for certain things like gift cards, different retailer gift cards to, TJ Maxx, Amazon, and so on. Just for doing all the healthy things that, you should be doing, and maybe a little extra effort in there too.
Now, is there just to kick off the incentive, if I were to join, do I get a welcome pack, or how's that happen?
Sure. Yep, you sure do. So each person that actually joins reidhealthier.org, they actually get a welcome bag in the mail. So includes a water bottle, an exercise little book or fitness book, kind of helps you track your goals along the way. And we've gotten some great feedback on those items that they've helped individuals out, as they're starting to venture out and start their well-being activities. So yeah, each person that signs up will definitely get one of those. If you're an existing member of it, tell somebody else about it, so they can also reap the benefits of being healthy. But we partner with our community benefit department, and community benefit, they actually support this initiative and for us to get it out in the community. And so we're really excited about it, that we'll continue to be able to offer this to our surrounding communities. And
there's also a method, if you log in, that possibly you could do a buddy or possibly a team, so that you can track how you're going in your fitness.
Yep.
So there's a
lot of different pieces to it. So once you get an account on reidhealthier.org, one thing that what happens is you can actually sync a wearable device to it. So if you have a Fitbit, an Apple Watch, it actually syncs over 25 different wearable devices to it, but those are the most popular ones. Even if you don't have a wearable device, you can actually sync your phone to the portal as well. And along the way, if you wanted to connect with a buddy throughout the portal, you can do that too. So it allows you to connect with different individuals at different time periods. That allows you to track all your activity on there, your sleep, your water intake, those type of things. So it's a good tool to use to kind of kickstart your overall well-being and wellness activity.
And we talked earlier with Dr. Ahmed about the emotional well-being of our teens, but let's talk about just with our adults as well.
I can't tell you, and I can't stress enough about the mental wellness of adults and children as well. Oftentimes the mental health of adults sometimes weigh on children, and so before you can even start any type of activity, one thing you have to have in check is that mental piece, because that's going to help you along the way. A lot of times, all the activity you may do, the physical, the nutritional piece, the social aspects of wellness, all kind of focus around that mental piece. So the physical activity part can help you, become more mentally sound by going out, taking, small walks throughout the day, just to kind of get in your own zone and kind of find peace. But before you can actually get serious and get into some of the more, serious spaces of well-being, we do look at the whole mental aspect and focus a lot on that. And that's one thing that you're going to see with our plans for 2022. It's going to be a lot more focused on the mental piece of it, and also the spiritual aspects of it too, because they go hand in hand for individuals.
Okay, and as we're ending the year, and especially the holidays, and that can be a tough time for some individuals. So what steps can they take now to prevent any emotional up and down because often when you're meeting you're meeting family members you haven't seen, especially this time that a lot of people are tending to gather more. So what would you recommend?
Well, couple of different things. First, I would if I didn't say this, then I would be wrong for not saying this. As we get together with our families and our friends and everybody, make sure we're cautious and we're being safe as well, because COVID is still out there. And you can ask any physician about this, and they'll also echo the same thing, is that we want to make sure that we're well aware of those individuals that are around us, so that way we don't pass anything to them, and they don't pass anything to us as well. So that's first. Just make sure you're putting yourself in a safe environment, and that'll also help you with the mental well-being piece too. So that way you're not frightened and feared the whole time as you're visiting individuals. At the same time period, just be patient with yourself. Don't rush yourself. Don't try to rush yourself through goals and different things that you're trying to reach. Take your time. It takes time in order for you to get yourself into a wellness state of mind. It's nothing that happens overnight. It's just not a switch that you flip on. It's things that you have to plan for. It's just like anything else. You have to take steps in the process to make sure that you're going around the right path for well-being overall and mental well-being. So again, I urge individuals to talk to professionals that are in this field. And again, we have our Reid Healthier Wellness program, and we have our Reid Healthier Wellness specialists that can also help individuals out and get them in the right mindset.
Great. And Tajuan, we have your contact information for Reid Wellness and the MOB.
Yeah.
And I want to thank you for joining us today on Reid Beside You, as well as Dr. Ahmed. And thank you for joining us today on this episode of Reid Beside You.